and Elsie. Okay, let's hear them talk about the story. First is you have been taking care of her. Karen have chest pain.
Chest pain.
So
Very
what
bad.
happened? Describe a little bit about how you help her.
Well, what happened, she went to the hospital and they just couldn't find out what was wrong. And they were giving her, I guess, all the different medication, right? And still, she was in pain until she heard about you, you know, and she said she'd try anything because she just couldn't breathe. That's what, you know. And
So why didn't you tell me about how bad you were before you came to see us?
I was so bad that, as young as I am, I didn't want to live anymore. I couldn't
Because
live.
you allowed them.
I couldn't live like the way that I was. And twice, my friend took me to ER, stayed with me. The doctors didn't know anything, and they even shot me with morphine, and that didn't help. And I would go home, and the pain would start again. And if I took a deep breath, the pain was so bad, I couldn't get the deep breath taken. So I felt like I was starving for air. And one day I had to walk down the staircase, and I couldn't. I had to sit down on the stairs and go down on my hind end.
Oh God, that's terrible.
That's pretty bad.
Bad.
It's pretty bad. For someone who used to be very active and then all of a sudden all of this stopped. So in 2003 this happened and I came and Dr. Tong.
Wait, so they did all the EKGs and all that?
Everything.
Okay, so what did that tell you? What did the EKG say? Is that
My
abnormal?
heart was fine. They didn't find anything wrong with my heart.
So here's a fallacy, okay? The symptom was so severe, and the EKG indicates your heart's normal.
And
Totally useless test.
echocardiogram too, very expensive test, and a stress test where you run on the
Yes. And all those are
treadmill.
normal.
Everything was fine. They said nothing
How can
wrong.
that be normal when the chest pain was so bad that she had to kind of sit down one step at a time to come down?
you can't
Okay.
breathe.
No.
I mean,
And then I went to all kinds of doctors, and everyone had a different diagnosis, and nothing helped. So out of desperation, I was thumbing through my book, and I just prayed that I would find somewhere that could help me. And my eyes just dropped on pain management, and I saw Dr. Tong's name, and I called, got an appointment right away. I even drove myself home after the first treatment.
So was it?
What a difference.
So how do you feel when you first saw me? And
I didn't have any life in me at all. And I can't remember, but I sort of remember. I think Dr. Elaine was here at the time when I first came in, if I remember.
but you were not
But
quite ready to treat.
Not
it.
ready to
Yeah,
treat,
yeah.
but just, she was here in the office.
Yeah.
But it's so hard to even remember because I was in such a state.
Yes.
I don't even know how I drove here, but I know how I drove home. I felt
Yeah.
a whole lot different after the injections. I had energy. And Dr. Tong said, don't overdo it, you're gonna feel great. Well, I could even vacuum the next day. But I was scared, so I kept coming back for another treatment. And Dr. Tong says,
But
you don't need more.
afterwards, after the first treatment,
I felt like
no pain?
no pain.
How was
And
the breathing?
The breathing was okay. I mean,
Deeper, right?
Deeper.
Yeah.
I didn't feel short of breath. I didn't feel starved for oxygen and air.
Yes.
And even though, you know, I felt like I couldn't get enough air, my blood oxygen saturation, even in the hospital, was 98, 99.
Here's another fallacy.
So there
All
was,
these tests are useless. So how many tests did I do?
so they didn't need to give me oxygen,
Yes.
but they gave me, the bill was thousands.
That caused more blockage,
More
more
blockage.
symptoms. The worry about
don't worry about the bill.
The bill.
That's
Okay.
Yeah.
So
But-
how many tests did I do on you?
None. Oh, you told me stick out my tongue.
That's the test.
Yeah,
Okay.
that was the
That's a very
test.
inexpensive test. Okay.
Yeah, very, yeah.
No, that's my high tech.
High tech.
test.
But you know what? It's
Yeah.
it's a true indication of what's going on in your body. And so after the treatment, I drove myself all the way home. And how many miles is it from here? Like 40, 50? 45, I think. 45 miles. I had no problem driving myself home. I felt really good the next day, and but then I was scared. I go, well, what if I don't feel good? What if this wears off?
But they did wear off.
But it never wore off.
They never did wear off, right?
And that
Yeah.
was in 2003. So
Yeah.
I'm.
You don't look like this in 2003. You look
No.
so much